Griffin Health has embarked on an innovative and pioneering initiative committed to providing quality, compassionate care to people faced with emotional crisis. EmPATH, meaning Emergency Psychiatric Assessment, Treatment, and Healing, is a specialized unit planned to be integrated into Griffin Hospital. It is solely dedicated to addressing the unique needs of individuals experiencing a serious mental health challenge.
Patients will reach out and they want help, but then they're directed to someone that now tells them there's a 6-month wait. You got to wait 6 months before I can fit you in for your first visit, which forces people to either become even more discouraged or depressed, or they come to the ER. And it burdens the ER systems too, because you have not only mental health and behavioral health, but you have medical patients that are seeking care. And they're all coming to one spot that has limited resources for everyone.
And as our core value to be a leader in the healthcare community, Griffin will be the first hospital in the state to offer an EmPATH unit. This space provides a safe haven for people in emotional distress, offering timely assessment, specialized treatment, and a path toward healing. A multidisciplinary team of experts, including psychiatrists, psychologists, social workers, and specially trained nurses, work collaboratively to provide personalized care.
We have seen at least 1 in 7 patients come into the emergency room in a mental health crisis. An EmPATH unit is designed to address the needs of the current situation in the emergency room. So people come into the emergency room in the worst day of their lives, being able to be seen by a crisis clinician, be moved to then this unit in which the healing process will start. They will be evaluated, they will be assessed, and the treatment is not only medications. The treatment also is very much related to the environment, being able to decrease the crisis, learn coping skills, and continue the process of the next steps.
In a traditional emergency room setting, healthcare professionals address a wide spectrum of medical needs, including critical emergencies and traumatic injuries. Mental health crises demand a unique approach that goes beyond traditional medical care.
The EmPATH unit, it's designed just for those patients in a space that's going to be low stress, low stimulation, therapeutic, more staffing, social workers assigned right on that unit to engage them, to work on resources, have more time to develop resources that there's not as much opportunity in the emergency room to do.
Serving as a vital support system, the EmPATH unit plays a pivotal role in alleviating the immense pressure on our emergency room staff so they can actually focus on medical emergencies, ensuring that critical cases receive the immediate attention they require. This targeted approach not only improves patient outcomes, but also reduces the strain on the emergency department as a whole. More importantly, the EmPATH team is well-trained and specialized to provide comprehensive care to individuals in emotional distress and address complex mental health needs. The importance of the EmPATH unit can't be overstated. It's a lifeline for those facing mental health crises, offering immediate access to care that can make all the difference. By creating this specialized unit, we're addressing an urgent need within our community and alleviating the stigma associated with seeking help for mental health challenges.
We're finding there's a lot of evidence-based research that shows that these particular units have decreased the amount of inpatient stays, decreased the amount of violence in the hospitals, decrease the need of resources for the medical side of the ED. That improves patient experiences.
Join us to battle the crippling hold that depression, anxiety, and suicidal thoughts can have on our neighbors as we need your help to fund this critical unit. We are deeply committed to providing holistic care that considers both the physical and emotional dimensions of health by fostering a compassionate, safe, supportive environment. And now, we need your help to make that a reality.
Having a beautiful space that can be therapeutic and helpful to our community members just exemplifies why Griffin is who they are, because we're putting the patient first. We're doing the right thing for them in the absence of other resources.
Griffin Health, empowering people, advancing care.